So Dr. Seglem, if you'll kick us off and just talk about our NICU and the size and what you do up there. And then Danielle, you just join in with him, okay?
Okay, once again, I'm Dr. Seglem. I'm one of the neonatologists at St. Bernard's. We currently have 3 neos, myself, Dr. Enrique Gomez, and Dr. Audra Stewart. We take turns taking call. When we take call, we generally take call 24 hours a day, 7 days a week, so 365 days a year. There's a neonatologist on call to serve the needs of these babies. We also have Danielle, who is a neonatal nurse practitioner. In addition to having years of neonatal nursing experience, after she had been a neonatal ICU nurse for a number of years, she went back to school to become a neonatal nurse practitioner. So a very specialized type of nurse practitioner. So between the 4 of us, we take care of on the order of somewhere between 250 and 300 babies a year. In the recent years, we've been pushing that 300 number. Usually, we have a census somewhere around 10 to 12 babies per day, sometimes less, sometimes we're at peak capacity. Peak capacity for our NICU right now is about 16 babies, with plans for expansion in the near future. We typically have a team of about 6 nurses up in the NICU, and sometimes have to flex up a little bit. But with a team of about 6 nurses, neonatal nurse practitioners some of the time, neonatal ICU doc, and then a team of dedicated neonatal respiratory therapists, we offer pretty comprehensive care for the babies down to a gestational age of as early as 26 weeks, which means that we're taking care of babies as much as about 3.5 months early. Birth weight's down to about 1.25 pounds, so we take care of some very, very tiny babies. With that, I'm going to ask Danielle if you want to pitch in and say anything that I've left off there.
Like Dr. Seglem said, we have a NICU that's 16 beds. That includes a 4-bed step-down unit, so that's for babies that are closer to going home, so that we can kind of get them away from our more critically ill infants and give the parents a better time to bond. That's one of our main goals in the NICU, is that our parents feel that they're involved with their baby's care and that they're able to still have those experiences with them, such as doing kangaroo care, getting to provide cares for them, which sometimes can be hard to do in the NICU, but we make every effort possible to do that for our parents. And Dr. Seglem mentioned our tiniest babies can be about 1.25 pounds, but we've also had babies up to 15 pounds. So we not only care for the smallest babies, but also the biggest babies that are also term. About 1 in 10 babies will need some type of NICU care. So we see a lot of different types of babies and a lot of different types of conditions. We also care for babies not only in Jonesboro, but all over Northeast Arkansas and even some parts of Missouri, and just for a wide range of conditions, from them having breathing troubles to not being able to hold their blood sugars, or sometimes just temperature issues. So we can treat just about any condition that doesn't need surgical intervention. We also accept transfers from hospitals that are higher level, so if babies did have to be transferred out, some of those we can get back and continue their care here closer to family.